It is a quiet Tuesday morning. Carol, 72 years old, pours her coffee and makes her way to the kitchen table. A white envelope is sitting there waiting for her. She has been putting off opening it for weeks. She lifts the flap carefully. Her hands start to tremble. Her Medicare supplement premium has just gone up by 24%. She does the calculation in her head. That is nearly $200 additional every month. Her entire Social Security increase for 2026? Erased. Gone before February even arrives. So she does what any sensible senior would do. She picks up the phone and starts calling other insurance companies to find a more affordable plan to switch to. And that is when the agent on the other end says the words that turn her world upside down. I am sorry. Before we can proceed, we need to ask you some questions about your health history. And based on the medications you are currently taking, we are not able to offer you a policy. Carol is stuck. And right now, in 2026, millions of American seniors are heading directly into that same situation without any awareness that it is coming. Hello, my friend. I am Miyu. And if you are 60, 65, 70, or older, what I am about to share with you over the next 10 minutes could protect thousands of dollars of your retirement income and preserve the medical coverage you spent your entire working life earning. Today, I am going to walk you through exactly what the federal Medicare rules actually state in 2026. Not speculation, not opinions passed around online, the actual rules drawn directly from Medicare.gov, the Kaiser Family Foundation, and AARP. I will show you the one specific period of time when you hold complete freedom to choose any Medicare supplement plan available in your state. I will explain what changes the instant that window closes behind you. And I will hand you a straightforward 3-step plan you can put into action this week to protect your coverage. But please, stay with me all the way to the end, because there is one hidden error that most retirees never discover until they are already unwell and in a desperate position, an error that can lock you out of affordable coverage for the remainder of your life. I will walk you through exactly what it is before we finish today. So settle in, get comfortable, and let us work together to protect your future. Let me introduce you to Robert. Robert is 67 years old, a retired postal worker from Richmond, Virginia. He gave 38 years to that job. He followed every rule placed in front of him. He paid every Medicare tax that was withheld from every paycheck he ever received. When Robert turned 65, he faced a decision that millions of seniors face. Original Medicare paired with a supplement plan, or Medicare Advantage. The Medicare Advantage commercials were genuinely appealing. $0 premium, free gym access, dental, vision, even a small monthly grocery allowance. Robert thought to himself, why would any reasonable person pay extra for a supplement plan when something like this is available at no cost? So Robert chose Medicare Advantage. And for the first 2 years, everything went smoothly. Then, at 67, Robert received diagnoses he had not anticipated: type 2 diabetes and a cardiac condition that would require consistent specialist care. Almost overnight, his Medicare Advantage plan began pushing back. The cardiologist he preferred was out of network. The hospital he trusted was not covered. Prior authorizations came back denied. Referral requirements appeared at every turn. Network restrictions seemed to block him at every step. Robert told himself it was a simple fix. He would return to original Medicare and purchase a supplement plan, the same kind his neighbor carried. He contacted 3 separate insurance companies. Each one asked the same set of health questions. Each one delivered the same answer. Mr. Robert, given your current diagnoses of diabetes and a heart condition, we are unable to extend a Medicare supplement policy to you at this time. Robert was completely unprepared for that response. He said, "But I have Medicare. Surely I have the right to use it." And the agent explained the painful truth. Outside of a specific 6-month window that existed when he first became eligible at 65, Robert had no federal right to purchase a Medigap plan. Not anymore. He had passed through a one-way entrance at age 65, and no one had ever told him the door locked permanently the moment he walked through it. Robert is stuck today. He pays a full 20% of every physician visit, every specialist consultation, every diagnostic test, with no limit on how much those costs can accumulate under original Medicare alone. Robert is not a careless person. He is a thoughtful, responsible man who was simply never informed about the rule. And that, my friend, is the trap I am here to help you avoid. Let me walk you through what is actually happening in 2026 using plain and direct language. First, the numbers you need to have in front of you. The standard Medicare Part B premium in 2026 is $202.90 per month, up from $185 the year before. The annual Part B deductible has risen to $283. That represents an increase of more than 10% in a single year. There is genuinely good news on one front. The out of pocket cap for Part D prescription drugs is now set at $1,200 for the year. Once your covered drug costs reach that figure, you pay nothing further until the calendar resets in January. But here's the development that is generating alarm among seniors right now. Medicare supplement premiums, the Medigap plans, are experiencing increases of 18 to 25% or more in states including Virginia, Washington, and South Carolina in 2026. That is the situation driving thousands of seniors to search urgently for alternatives. Now, the rule that defines everything else. Federal law provides you with one, and only one, protected window to purchase a Medigap plan with full legal guarantees behind you. It is called the Medigap Open Enrollment period. It lasts exactly 6 months. It begins on the first day of the month in which you are both age 65 or older and actively enrolled in Medicare Part B. During those 6 months, and during no other period, federal law delivers 3 powerful guarantees. First, you may purchase any Medigap policy that is sold within your state. Second, the insurance company is legally prohibited from asking you a single question about your health. Third, they cannot deny your application, raise your rate, or impose a waiting period based on any pre-existing condition, including diabetes, cancer, or heart disease. Once those 6 months have passed, the federal protection expires. And the law no longer guarantees your right to switch plans. In most states, insurance companies are then permitted to apply medical underwriting. They can reject your application, they can charge you significantly higher rates, or they can impose a waiting period of up to 6 months before paying claims connected to any pre-existing condition. The 4 traps that are catching seniors off guard. Trap 1. A large number of seniors believe they can compare and switch Medigap plans each autumn during the Medicare Annual Open Enrollment period, which runs from October 15th through December 7th each year. This belief is incorrect. That enrollment window exists exclusively for Part D drug plans and Medicare Advantage. It has no bearing on Medigap whatsoever. The Kaiser Family Foundation addresses this distinction clearly in its published research. Trap 2. This is Robert's trap. Selecting Medicare Advantage at 65 and then attempting to purchase a Medigap plan years later, once health conditions have developed. Beyond a limited 12-month trial right that applies only the very first time a beneficiary joins a Medicare Advantage plan, no federal guaranteed right to return exists. KFF research documents that insurers regularly and legally deny these applications. Trap 3. Assuming a Medigap premium will remain stable. It will not. Premiums increase annually due to the policyholder's advancing age, inflation, and the carrier's claims experience. In 2026, these increases are at historic levels across many states. Trap 4. Confusing Medigap with Medicare Advantage. These are fundamentally separate programs operating under separate rules. They cannot be held simultaneously, and the rules governing when and how you can switch between them are entirely different. The legal protections that genuinely exist for you. I want you to know your rights because they are more substantial than many seniors realize. You have the 6-month Medigap Open Enrollment period at age 65. Use every day of it thoughtfully. You have guaranteed issue rights in defined situations. If your insurance carrier becomes insolvent, if your plan is discontinued, if you relocate outside your plan's service area, or if you lose retiree coverage through a former employer. These situations open a 63-day window during which you may purchase certain Medigap plans without underwriting. You have a 12-month Medicare Advantage trial. Right the very first time you enroll in an Advantage plan at 65. If the plan does not meet your needs, you have up to 1 full year to return to original Medicare and select any Medigap plan sold in your state. You have a 30-day free look period when purchasing any new Medigap policy. Federal law entitles you to cancel within 30 days and receive a complete refund of any premiums paid. If you reside in Connecticut, Massachusetts, Maine, or New York, your state mandates that Medigap insurers accept applicants throughout the year, regardless of health status. Several additional states, including California, Oregon, Missouri, Washington, and Idaho, offer a birthday rule that allows a limited annual switching opportunity without requiring medical underwriting. And if your income places you in a higher bracket, and you are currently paying IRMAA surcharges on top of the standard $202 and $9 premium, you may submit Form SSA 44 to the Social Security Administration following a qualifying life-changing event such as retirement and formally request that your premium be recalculated based on your current lower income. These are not workarounds or loopholes. These are federally and state-established rights, but they can only help you if you know they exist. What should you actually do right now? Here are 3 concrete steps. Write them down as we go. Step 1. Determine exactly where you currently stand on the Medicare timeline. Go to Medicare.gov and log into your account, or call 1-800-MEDICARE directly. Confirm the date your Part B enrollment became active. If you are still within your 6-month Medigap Open Enrollment period, you are in the single most powerful position you will ever occupy in the Medicare system. Do not let it pass without taking action. Compare every Medigap plan available in your state right now. Select the most comprehensive one your budget can support, because this window will not return once it closes. If you are past that window, research whether your state offers a birthday rule, an anniversary rule, or year-round guaranteed issue protections. That information alone could represent thousands of dollars in savings. Step 2. Before making any changes to your coverage, contact your state health insurance assistance program first. This service is provided at no cost. Every state in the country operates one. SHIP counselors are professionally trained and do not work on commission or sell insurance products of any kind. They will review your specific situation and explain your actual rights and realistic options in clear, honest language. Never base a Medicare decision on a television advertisement or the recommendation of a phone salesperson. Always verify with your SHIP counselor first. You can find the contact information for your state's program at Medicare.gov. Step 3. Build a dedicated Medicare document file today. Collect your Medicare card, your Part B enrollment confirmation, your current Medigap or Medicare Advantage plan documents, a current list of your prescriptions, and copies of any premium increase notices you have received. Store everything together in a single folder. If you are ever denied a claim or presented with an unexpected charge, this file becomes your evidence. And if you ever need to file Form SSA 44 to request a reduction in your IRMAA surcharge following a life change, every document the process requires will already be in one place. 3 steps. 1 focused afternoon, a foundation of protection that will serve you for years. My friend, before you navigate away from this video, I want to leave you with one final thought. And I ask that you hear it carefully. Medicare rules are evolving more rapidly in 2026 than they have in a very long time. Premium adjustments, underwriting changes, revised IRMAA brackets, updated Part D regulations. And by the time a video covering any of those changes surfaces in your YouTube feed, the deadline connected to it may already be behind you. You cannot afford to depend on YouTube notifications alone for information this critical to your financial security. The platform's algorithm operates on its own schedule. It does not prioritize your retirement. That is precisely why the Global Senior Alerts Official WhatsApp channel was created. It is entirely free to join. When you become a member, you receive real-time alerts on the same day any relevant rule changes, covering Social Security updates, Medicare deadlines, pension news, banking regulations, insurance policy changes, and even travel rules that specifically affect senior travelers. And as a thank you for joining today, you will receive immediate access to the free Senior Benefits Protection Guide, a practical, printable PDF checklist you can keep at home as a reference. It walks through every right we covered in this video, along with the exact phone numbers and forms you may need when the time comes. Click the link in the description section directly below this video. It takes less than a minute, and the protection it provides can last a lifetime. If today's video was helpful to you, please give it a thumbs up. Share it with your spouse, a sibling, or a friend who is on Medicare. They deserve to understand these rules just as much as you do. And subscribe to this channel because next week, I will be breaking down a new Social Security regulation that is receiving almost no coverage anywhere. Until then, stay informed, stay protected, and always remember that your benefits represent a right you earned. No one will advocate for them more effectively than you. This is Miyu. I will see you in the next video.